Trigenics is also known as Myoneural Manual Medicine. Myo for muscle, neural for nerve, and manual for being performed by hand. Trigenics, as the name implies, consists of 3 procedures: resisted exercise, nerve receptor activation, and a neurologic breathing technique. Trigenics retrains the way the nervous system controls muscles associated with a joint. It can reduce pain, improve motion, and restore strength and stability. Often the results are immediate and dramatic. Before I demonstrate a Trigenics treatment, I want to explain how it works. When an injury occurs, our body goes into a protective mode. For example, if you sprain an ankle, it will swell up and the muscles surrounding it will splint. They tighten up to protect it from further injury. This is an appropriate and necessary initial response. However, if the muscle contraction persists after the injury is healed, it can allow an acute injury to progress into a chronic degenerative condition. The same process can occur as a result of repetitive use from chronic postural stress. So you don't have to have an injury to get chronic joint pain. Regardless of what caused the imbalance, the solution is the same. Joint motion and stability must be restored. Trigenics accomplishes this by retraining the way the nerve system controls the muscles associated with the joint. Trigenics is not a soft tissue technique. By that, I mean it doesn't break up or stretch out scar tissue in the muscle. Treatments are applied to accomplish one of 2 objectives: to either lengthen shorten muscles or to strengthen weaken muscles. Treatments work by changing the neurologic integration of the muscle. The lengthening treatment changes the length-tension ratio in the muscle. If you'd like to learn more about this, you can Google topics like intrafusal and extrafusal muscle fibers and alpha-gamma coactivation. I wanted to talk about these, but my producer told me you would fall asleep if I did. A treatment begins by examining the length and strength of the muscles associated with the joint. Those findings are noted, patterns are evaluated, and from this, a sequence of treatments is determined. As an example, I'm going to demonstrate the 2 treatments that are frequently used with a chronic shoulder condition. I'd like to introduce you to Judy. Judy is one of our all-star patients. She came to us with a laundry list of different symptoms, neck pain and low back pain. On the top of the list, although today she's telling me she has some right shoulder problems, her left shoulder was a real trouble spot for her. So with the treatments that we've used, we've focused on that left shoulder and using the Trigenics procedure to work to restore motion, to restore strength and stability. Judy has made huge improvement from where she started. Intentionally for this video, I didn't let her get treatment for the last, week or 2 weeks or something. She's a little unhappy with me about that, but it was to be able to demonstrate what the Trigenics procedure does, how the treatment works. So Judy's assessment, we found consistently restricted motion in certain planes with her left shoulder, and we're going to demonstrate that next. So Judy, what I want you to do is raise this right arm up for us. Good, so her good arm, if you will, and down, and then do the same with the left, but stop where it gets tight or painful. So we're losing maybe 45 degrees of motion on that. You can bring that back down. Judy, let's do this. I want you to swing around and face towards me. We're going to check motion with you reaching around like you're trying to scratch your shoulder. I want you to do that, the right side first. Now, I'll have you note how high she's able to get on that. Judy, bring that down, then come around with that left one. And you can see that's probably, 3 inches difference on that. That's contraction in these muscles on the left side. Last test, actually, Judy, I'm going to have you swing back around to this side for us. Those are assessments for decreased length of muscles. I want to demonstrate also reduced strength because of the shoulder problem. One of the things we found on her initial exam was weakness in the bicep long head muscle that runs here. So Judy, push up into my hand. Judy is strong. You don't want to mess with Judy. She's strong on the right side, pushing up, but on the left side, not so much. Okay, so we've identified specific muscle groups that we want to lengthen, specific muscle group, in this case the bicep, we want to strengthen. So we're going to start with our lengthening procedure. Judy, I'll have you swing around so your knees are on that side. So we're going to be working on lengthening her latissimus dorsi. I'm actually going to get in and work on her teres a little bit today too. Perfect. Judy's holding on to the side of the table. Trigenics, as I said, 3 procedures. We're working with resisted exercise. We're using nerve receptor activation. And the third component is a breathing exercise. So Judy is going to make a S sound. We want her exhaling the whole time that we're applying the treatment procedure. That shifts her neurologically into a parasympathetic state instead of sympathetic. What we don't want her doing is holding her breath while we're doing the treatment. So Judy, I'm going to have you take a deep breath in and give me S as you push down into my hand. Perfect. Hold that pressure. That's just right. So I'm working on points in her latissimus dorsi and relax. Good. And I'm going to stretch. And in her teres muscle. Take a deep breath. So Judy is pushing down into my hand with her elbow, contracting the muscle, and relax. And then I'm stretching it. Again, breath. Great, Judy. Hold that for 3, 2, 1, and relax. So activating the nerve receptors in the muscle, contraction, stretching. We're going to retest what that did for our length, but before we do, we're going to do our treatment to restore the strength of that bicep muscle. So Judy, let's have you stand for us. And I'm going to have you stand right next to me here. Perfect. So this one, Judy is a pro at this. We're going to keep those fingers open. Again, you're going to be pushing and you're going to rotate out when we get to the last. So for this procedure, the Trigenics strengthening procedure, strangely enough, we're going to have her use the opposite muscle, what's called the antagonist. So Judy is going to be firing her triceps muscle, which is extending her arm, while I'm working on the biceps muscle, particularly on the insertion points that are probably tender. Okay, I'll stop that. Deep breath. And start that twist. Excellent. And breath, and good. And twist, and twist, and twist, and relax. You doing okay? Uh-huh. One more. Judy will tell you that this is not fun. Good. But it is effective, huh?
Yes, absolutely.
Okay, so there's our lengthening and our strengthening Trigenics procedures. Now we're going to retest and see how we did. Judy, I'll have you take a seat. And as you did before, to this right side, I want you to give us adduction. Free it easy. And left side, look at that, she comes to her head. Beautiful. Let's demonstrate that. It's called scratch test too. I'm going to have you swing around. We'll go back and forth a little bit, but I want to do it in the same sequence. So your right side, again as before, straighten that thumb out for me. There we go. Great. And down. And now let's see how we did on the left side. And I'll move the crease in the shirt, probably within a half of an inch. So nice gains in our motion. Now let's see how that did for strength. So I'm going to have you swing around one more time to this side so we can test your bicep. So you are there and you're pushing up. Again, really strong. And pushing up. And Judy now, really strong. Yep. So that's something you can't really see. It's something you more have to feel. That was a marked difference, wasn't it?
Absolutely, yeah.
Yeah. Judy, thank you so much for being willing to come and let us demonstrate. Helping patients get better and stay better is why we provide the comprehensive treatment approach we do. Again, I hope the information in this video encourages you to fully participate in your treatment program. It's the best way to get relief with results that last. Thanks again for watching. If there's any way we can be of help, don't hesitate to let us know.